All right. So you know how sometimes you want to like really get to the heart of how something works and like you read all these different things, but you just want somebody to lay it all out there for you. Well, that's kind of what we're doing today. We are going to be like diving deep into healthcare in India, and it's really interesting stuff.
Yeah, it really is.
We got our hands on some really great material for this. It looks at how the private healthcare sector is regulated, what's going on with emergency medical response and ambulance services, and how vaccine policy and distribution is working over there. So lots to dig into today.
For sure. And it's interesting stuff because, I mean, thinking about all this, it's like we got to look at the big picture first, right? I mean, what are the big challenges? And then one of the big things that really pops up is the whole idea of needing political collaboration to make things better for everyone. We see that again and again.
Yeah, and that's a great point. One of the things that really jumps out is the fact that the private healthcare sector in India is just huge. I mean, we're talking 70% of all healthcare services are delivered through private providers.
Yeah, that's massive. So, that alone kind of tells you that understanding how all that is regulated is absolutely key. I mean, 70%, that's the majority of healthcare that you or anybody in India is probably going to be accessing. So,
Right, it's really the foundation. Okay, so let's start with that then. Let's unpack how the private healthcare sector is regulated, or maybe how it's not regulated. One of the things that's interesting is that there's no real consistency across the country because healthcare is primarily a state subject in India. Each state has their own rules or maybe no rules at all. And as you can imagine, that leads to all kinds of differences in pricing, in quality, in patient rights. I mean, just think about this. You could have like two patients in different states having the exact same procedure, but their bills are wildly different.
yeah, it's a real problem. And you can see how that immediately raises questions about affordability. And it's not just the price tag itself, right? It's also the fact that without standardized pricing, it becomes really hard to assess quality across the board. How do you compare apples to oranges across different states? So it makes it tough for policymakers to really get a handle on where they need to step in and, make improvements. And this inconsistent regulation also leads to real problems with patient rights and with the overall quality of care.
Right. On one hand, you have these top-tier private hospitals that are operating at international standards. And then on the other, you've got these smaller facilities that may be operating with minimal oversight. So it creates this real spectrum of care, which can be pretty unsettling for patients.
Exactly.
And this lack of consistent rules around pricing and quality leads to some pretty serious concerns. I mean, we're talking about potential for overcharging, maybe even unnecessary procedures. And then when you factor in things like a concentration of private hospitals in urban areas and a lack of access in rural areas, well, it really starts to paint a picture of a system that's in need of some attention.
Yeah, and it's really interesting how those issues start to mirror some of the things we'll see when we talk about ambulance services, too. This idea of mixing public and private providers, but without clear national standards. I mean, it can lead to the same kinds of problems with quality and access.
Yeah, that's a great point. So if we look at the broader political and regulatory landscape, it's pretty complex. We've got this division of power between the central government and the state governments when it comes to healthcare, and that makes it really tough to create and enforce any kind of national standards. Plus, there's often resistance from the private healthcare providers themselves. I mean, naturally, they're worried about increased costs, reduced autonomy. But, at the same time, you have to wonder what they're really afraid of.
Yeah, I mean, their concerns are understandable to some extent. Nobody wants to see their costs go up or feel like they're losing control.
Right. But is it all valid? I mean, I think about the fact that there's no standardized cost for treatments across India. You mentioned other countries having price caps. That's a huge contrast. And, with so much healthcare being insurance-based through these private hospitals, you can imagine the chaos. The lack of standardized agreements between the insurance companies and the providers has got to create a ton of inefficiencies. I mean, I can't even imagine what that must be like.
Right. So, there was an attempt to bring some order to all of this with this Clinical Establishments Act back in 2010.
Oh, yeah.
The idea was to establish, a framework for registering and regulating all these clinical establishments. But it hasn't really been implemented very well. A lot of states just haven't fully adopted it. And it's the same story, right? You've got political roadblocks and then pushback from the industry itself.
So it sounds like the key to making any real progress here is political collaboration.
Yeah, definitely.
You've got to get the different political parties and state governments on the same page. I mean, that's no easy feat. But if they could agree on some basic things like uniform pricing for treatments and minimum benchmarks for quality, that would be a huge step in the right direction. I mean, how can they not see that?
And then you have a whole issue of enforcement. You can have all the regulations you want, but if nobody's following them, then what's the point? I mean, you need some teeth.
Right. I mean, strengthening these healthcare tribunals to give patients a way to address their grievances and protect their rights, that just seems absolutely crucial.
Yeah, I mean, if you want people to trust the system, they need to know that there's a way to hold providers accountable.
And if you're thinking big picture here, it seems like a good idea to integrate these private hospitals more with public healthcare initiatives like Ayushman Bharat that would help expand access.
Right.
And then, things like transparent billing, strict penalties for unethical behavior, all of that could help to build a more trustworthy system. And, we talked about those underserved rural areas. Well, it sounds like public-private partnerships, those PPPs that everybody's always talking about, could be a really effective way to build up more healthcare infrastructure.
Yeah, that could really make a difference. I mean, there are lots of models out there that have been successful in other places. It's just a matter of finding the right fit for India's context.
Right. So if we step back and look at the big picture again, the economic and social benefits of effective regulation are pretty significant.
Oh, absolutely.
I mean, you're talking about increased affordability, greater access. That directly impacts people's lives. It reduces the financial burden on families. And if patient trust goes up, well, that could even have a positive effect on medical tourism. It could enhance India's reputation as a destination for high-quality care.
Exactly. And then ultimately, you'd be looking at a more balanced and sustainable healthcare ecosystem overall.
Okay, so let's shift gears a little bit. Let's talk about emergency medical response and ambulance services. It sounds like there's a real mix of providers in India. You've got government-run services, private companies, NGOs, all kind of operating in this space. But the thing that jumps out immediately is the lack of adequate ambulance coverage, particularly in rural areas. I mean, that's a huge issue, right? That's literally a matter of life and death.
Yeah, it absolutely is. I mean, think about it. You're in a rural area and you have a medical emergency. Your access to timely care is already limited. But then if there aren't enough ambulances or they can't get to you quickly enough, well, it's just a recipe for disaster.
Okay. And then even in urban areas where there might be more ambulances, the response times can be inconsistent. Traffic, poor infrastructure, it all plays a role. And then you layer on top of that the fact that a lot of these private ambulance services are unregulated.
Yeah, it's a free-for-all.
So you get arbitrary pricing, quality can vary wildly. It's a little scary when you think about it.
And, it's not just about getting an ambulance to the scene. It's also about the quality of care that the patient receives once they're in the ambulance. I mean, pre-hospital care is crucial. It can make a huge difference in the outcome. But if you don't have enough trained paramedics, well, then the ambulance is just a transport vehicle. It's not really providing the level of care that it could be.
Right. And then there's the whole coordination aspect, too. You've got the ambulance, the hospitals, the emergency call centers, and they all need to be working together seamlessly.
It has to be a well-oiled machine.
But that doesn't always happen. So, you've got these government-run services like 108 and 102, which are essential. They really are. But they're often hampered by a lack of funding and resources.
Yeah, they're understaffed. The infrastructure is outdated.
So it's really difficult for them to operate as effectively as they could be.
I mean, think about the possibilities. If they had the resources they needed, they could be reaching so many more people, providing higher quality care.
So just like we saw with the private healthcare sector, we're running into political and policy barriers that are hindering progress in EMS.
Yeah, I mean, that whole state versus central control thing pops up again. It leads to different standards and different levels of investment across different states. It's a patchwork system.
And it sounds like there's no unified national policy for EMS.
Yep, no real framework to provide any consistency.
So everybody's kind of doing their own thing. And then just like before, you've got resistance from the private operators against more regulation.
They don't want anybody telling them what to do.
And another big missed opportunity is this lack of a national tech-driven emergency grid. I mean, imagine a system where the dispatchers could see in real time which ambulances are available across all the different providers. That could be game-changing.
It would revolutionize things, wouldn't it? I mean, that kind of coordination would save so many lives.
So it seems like political collaboration is just as important in this area as it is in healthcare regulation. Standardizing ambulance services nationwide, ensuring quality and accountability, having some kind of consistent pricing structure across the board. These are things that just make sense.
They really do. And, we talked about those PPPs before. Well, they could be a really effective way to increase the number of ambulances on the road, particularly in those underserved areas.
Right.
And something that's really close to my heart is, we need to be investing more in training for emergency responders. We need skilled paramedics who can provide that critical initial care. I I mean, that can make a world of difference.
And ultimately, it all comes down to implementing a national EMS network that integrates all these different players and ensuring sustainable funding models for both the public and the private sector. I mean, that's a tall order.
It is, but it's doable. There are models out there. We just need the political will to make it happen.
Right. But think about the impact. If we could improve EMS in India, we'd be talking about reducing preventable deaths. We'd be strengthening our ability to respond to disasters. It would increase public confidence in the system. It could even boost medical tourism, showcase India's emergency care capabilities.
Absolutely. It's all interconnected.
Okay, so let's move on to our final topic for today. Let's talk about vaccine policy and distribution. Now, India's already got these huge immunization programs in place. You've got the Universal Immunization Program, Ayushman Bharat, but there are still some big hurdles that need to be addressed.
Yeah, I mean, they've made tremendous progress, but there's always room for improvement.
And that old chestnut state versus central coordination, well, it pops up again here, this time with vaccine procurement and pricing. It's like a broken record.
And, a big challenge is making sure that everyone has equal access to vaccines, particularly in rural areas. I mean, availability is an issue, but so is having the infrastructure to properly store the vaccines. You need that cold chain to be working perfectly, or else the vaccines are no good.
Right. And the way private and public distribution is handled is also pretty complex.
It's a delicate balance.
I mean, on the one hand, you want to involve private players because that can increase access for some people. But on the other hand, you have to think about affordability. What about those vulnerable populations that can't afford to go the private route? Plus, budget constraints impact everything. I mean, it impacts outreach efforts, research into new vaccines.
And then when you look at the political and policy landscape for vaccines, you see that it's incredibly dynamic.
Always changing.
Decentralized decision-making across different states can lead to inconsistencies in how vaccines are rolled out. And, we've seen political considerations influence pricing and availability.
It's never as simple as it should be.
And there can be regulatory hurdles in getting new vaccines approved. It can be a real challenge to navigate.
So, we talked about public-private competition before and how it can sometimes create affordability barriers. Well, that's a real issue here. I mean, the goal is to increase access, but you don't want to do that at the expense of those who need it most. And then something that I think is really important to consider is India's reliance on international collaborations for certain vaccines. I mean, that highlights a potential vulnerability in the supply chain, especially during a global health crisis.
Yeah, we saw that during the pandemic.
Right. When supply chains break down, everybody suffers. So that's the answer.
Well, it sounds like what we need is for the political powers that be to finally come together and establish a unified national vaccine policy. I mean, that would be a game changer.
Right. I mean, stronger public-private partnerships for manufacturing and distribution, investing in that cold chain infrastructure. These are things that just make sense.
And something else that I think is really important is we need to boost India's indigenous research and development capabilities.
Make it in India.
Exactly. We need to be less reliant on external sources. And, we talked about awareness campaigns. Well, they're crucial when it comes to vaccines. We need to be building public trust. I mean, high vaccination rates are essential for a healthy population.
Right. And, looking ahead, we need to be thinking about the next pandemic. We need to develop a supply chain that's crisis ready. We can't afford to be caught flat-footed again.
Yeah, those lessons are hard learned, but we need to take them to heart.
So if we step back and look at the potential economic and social impact of a well-structured vaccine policy, it's huge.
It really is.
I mean, you're talking about preventing disease, reducing healthcare costs across the board. A healthier workforce is a more productive workforce, and India's position as a global vaccine supplier would be strengthened. And then there's the intangible benefits, increased public trust, a sense of security, knowing that we're prepared for whatever comes next.
Yeah, it's hard to put a price tag on those things.
Right. So, as we wrap up today, it's really striking how this theme of political collaboration keeps coming up again and again. It's like every facet of India's healthcare system is touched by it, from regulating private hospitals to improving emergency response to ensuring effective vaccine distribution. It seems like it all hinges on the ability of different political factions to work together.
Yeah, I mean, it's like a common thread running through all of this. If they could just put aside their differences and establish some consistent nationwide policies, I mean, it would be transformative.
Absolutely. And, the sources that we've looked at today, they make it very clear overcoming these political hurdles and creating these consistent policies are crucial steps towards creating a healthcare system that works for everyone, a system that's equitable and affordable and efficient.
It's the only way forward.
And that leaves you with this thought. Both the state and central governments have a huge role to play in shaping healthcare in India. So what single step do you think would have the biggest, most immediate positive impact? I mean, think about it. Think about all the things that we've talked about today. These issues are all interconnected. If you could find the right leverage point, you could really move the needle.
It's a great question to ponder.
It is.
I mean, it really makes you think about the possibilities.
It does. All right, well, on that note, we're going to wrap things up for today, but thank you for joining us for this deep dive into healthcare in India. It's been an enlightening conversation.
It really has.
And, hopefully it's given you some food for thought. We'll see you next time.
See you then.